Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
I think that cruciates are the biggest can of worm discussion that anyone can ever endeavor in, because there's so many factors, there's so many treatments.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, Kathy. How are you today?
Good afternoon, Chris. I'm doing all right. Just came back in from taking Mac for a nice little walk, and now he's resting comfortably watching Judge Judy.
Well, let's hope that lasts.
I hope so, too.
Well, I'm kind of stoked because I have my endorphins and enkephalins going. I just got back from my own physical therapy, some arthritis in my knees that I'm dealing with from a lifetime of sports and kneeling and squatting and lifting, but it is getting better. And today when I was talking to Ivan, my therapist, he said that they're experimenting with, I feel like he said like vascular therapy or blood flow therapy. And I looked at him like, he was nuts. They're basically taking like a blood pressure cuff and putting it around the thigh and restricting some of the blood flow to the muscles of the leg, developing kind of the same stresses as one would do with a lot of exercise. So with less blood flow, there's more, lactic acid buildup and, you fatigue quicker because we all know blood circulation is imperative, and we need to feed our muscles, but they're doing this on purpose to mimic this kind of physiological response in the body. Think about like a knee and a torn ACL or cruciate ligament. Right after surgery, you can't exercise hard. They still, we see profound atrophy and things like that in the muscles. He said, but with the blood pressure cuff on and exercising, you're mimicking that. So you get the same responses and less atrophy. I was blown away. I've never heard of this. I thought that was
I have never
wild.
heard of this, Chris. I mean, it makes sense, but I've never heard of this. Like, it's very interesting. I guess we'll see. There's so many things that are coming down the line in veterinary medicine, too, for treatment of cranial cruciate ligament tears. So it'll be interesting to see how these develop.
Yes. And I thought it was I'm probably, not explaining this well at all, but Ivan even said, you should try it with the dogs. And I said, well, ironically, this afternoon, we are interviewing Dr. Christin Finn about cranial cruciate ligament injuries or CCL tears.
Yeah, it's the most common injury we see in rehab in veterinary medicine.
Exactly. And I like how ironic that you're bringing up this kind of new modality, because I'm hoping Dr. Finn will be able to expound on all the different kinds of potential interventions to manage cruciate tears, whether one chooses surgery or chooses to go the more conservative route. And for those of you who may not have listened to all of our shows, almost 3 years ago in 2021, we interviewed Dr. Marianne Nieves, who is a board certified surgeon. So naturally, she had a bias toward surgical repairs of this injury, the cruciate ligament. And that's a fantastic show as well, and a great resource for knowledge and education. But again, Dr. Finn is going to introduce, I think, a lot of alternative things that can be done with every dog, no matter if they have surgery or don't have surgery. And I'm so excited to pick her brain a little bit.
Yeah, me too. And the first thing I thought of was there's a portion of the population of animals that I see that for one reason or another don't qualify to have surgery. And so what do we do with those patients? What can we do for those patients that maybe they can't have surgery for whatever reason? Maybe they have comorbidities that don't make them good candidates for surgery. So what do we do with those animals?
Exactly. And Kathy, I don't know if I told you actually how I met Dr. Finn, because I just introduced you as we were getting on for this recording today, but she is a mutual friend of our dear friend, colleague, and promoter of pet health, Alon Landa, the CEO of MedcoVet. He thought that Dr. Christin Finn and I and Petability had a lot in common in terms of our goals and how we want to help the masses, as many pets as possible to get better. And so I remember in our initial conversation, Dr. Finn actually said she thinks that every pet owner should have a laser in their home. He loves the Luma, as do we, and they are our sponsor, as you know. So I think that's just, we share common ground there, and that's fantastic. She also is a Petability listener. And when we talk, she's like, I'd love to be a guest on your show. So, how cool is that? Here we are today. Back to, why Dr. Finn is actually here. So as I said before, her self-professed jam is cruciate injuries. I've come to realize as I've recently started following more groups related to canine animal rehabilitation on Facebook, how much need there is out there for good information. Because as you said, Kathy, it is such a common condition. And pet owners have so many questions, and so many want to avoid surgery in lieu of conservative management for this injury. So, we want to assure them that there's no bad choice. I know Dr. Finn says, I'm going to meet that pet owner where they are. And I just love that. I do know, as indicated before, that there are certainly things that can benefit every dog with a cruciate injury, no matter what path they end up taking. And Dr. Finn is here to discuss the options for care, focusing on conservative management of cruciate injuries as she fulfills her mission of educating, empowering, and inspiring pet owners. So before we begin peppering Dr. Finn with questions, I'd like to share a bit more about her. Dr. Christin Finn, an integrative and rehabilitation veterinarian, is obsessed with musculoskeletal structure and optimal movement of animals. Currently, Dr. Finn channels this passion to educate, empower, and inspire dog and horse owners to help their own pets' pain and lameness. She's a graduate of the University of Minnesota College of Veterinary Medicine, and she continued her training and certification in veterinary chiropractic, osteopathic manipulation, veterinary acupuncture, and Chinese medicine, as well as canine rehabilitation. Dr. Finn has spent the last 2 years making video guides to aid dog owners to be proactive partners in their pets' health and mobility, as well as guides to help them navigate the difficult challenges of their pets' injuries. She connects with pet owners online through her unique business model, which I want her to tell us more about at the end of this episode today. So stay tuned for that. Welcome, Dr. Finn, to Petability.
Welcome, Dr. Finn.
Thank you, ladies, so much. I am so thrilled to be here and to speak about what is my passion, is inspiring and educating owners who are doing everything they can already to help their dogs, but they just have so many questions.
So, Dr. Finn, can you remind our audience what the cranial cruciate ligament is, where it's located, its function, etc.?
Absolutely. So the cruciate ligament, or otherwise known in the human world as ACL, which stands for anterior cruciate ligament, we're talking about the same structure. It's fibrous ligamentous band that goes from the outside of one side of the knee through the joint to the other side, and it's providing stabilization. Why does it matter? It's cross stabilization, which is why it's called cruciate. And when that stabilization is lost from an injury, it destabilizes the joint. And then the obvious question would be, well, why is that important? And because an unstable joint is painful, affects ability to have good mobility, and starts the cascade of arthritis.
Why do you think this happens so commonly in animals? I mean, I guess I would say the largest portion of animals that I see with CCL tests are typically, Labrador retrievers, Rottweilers. I saw a patient who was a Bichon with a CCL tear. What's happening? Why are we having this happen so often?
I think that is a fantastic question. And I ask myself the same thing, every day, is making sure that I'm accounting for what are the factors of this multifactorial situation. We have changed so much about our dogs, the way we handle them. When I was a kid, your dog was outside. And of course you fed him lots of whole foods. So I think and no dogs were overweight when I was a kid, or even when I was in veterinary school. So we know that weight is a very large factor. We know that spaying and neutering before puberty, which is 18 months. And so their studies have been done that there's an 86% greater chance of your dog entering their cruciate if they're spayed or neutered before 18 months.
Wow.
So that's something that's changing. Dogs used to wander. Basically, for 60,000 years, dogs milled around all the time. Wolves milled around looking for food. And then they were building muscle tone and flexibility and adjustability or adaptability of their movements. And now dogs chase a ball at one time after another, sprinting, out of shape, right? So owner comes home from work and they're like, gosh, I want to give my dog fun. The dog is an adrenaline junkie just like us. He wants to chase that ball. So they're overweight, they're unfit, they're spayed or neutered, they didn't warm up and are chasing the ball over and over again. And that leads, I have an expression that I use, and some may find this disagreeable as a phrase, but I would stand by my phrase that every ball leads to a cruciate. Meaning not every time you throw the ball, but every time there's a ball, it's never thrown once. And so the number of clients that have come to me and their story begins, well, we were doing the chuck it at the beach, and I know the end of the story. It's a cruciate, and it breaks my heart because they're not setting out to do damage on their dog.
I have a similar phrase where I tell people that, you can throw that ball 100 times and your dog is fine. And then you throw it one more time and your dog has torn their cruciate ligament.
Absolutely. But in truth, the cruciate injury in a dog is considered a degenerative condition. Unlike the football player that is fine and blows his knee out on Sunday afternoon in a game, that was a sudden blowout of the ligament. With dogs, it's like you tore some fibers. My favorite analogy is a glass at the edge of the table. The glass may have taken years to months to move along that table. The UPS man came, you threw the ball, they jumped off the deck. All these things add up to that 100th ball throw when it seems like all of a sudden. But to me, it's really good news. It took a long time to get there. So there is one, hope that you never get there because there's things we can do preventatively. But two, it's not an emergency. It didn't truly happen overnight. Like the blowout, the final straw, so to speak, happened in one moment that you saw, but the degeneration or the damage of torn fibers over time took a while. So you've got a while to start getting control and mitigating the acute, like my dog is painful right now.
I love the fact that you threw in, the prevention component, and based on, how you describe things happen, that totally makes sense. Because if we know our dog is withstanding, some of these factors over time, then we can change those factors.
If you really ask yourself, if it's your dog, has there been other episodes? Well, yeah. I mean, there was a day when they limped, but then they chased a squirrel. So I thought they're fine. Your dog, another point I like to really share with dog owners is your dog's genetically has 60,000 years experience hiding their injury. Being a wolf, you better hide your injury. That's 60,000 years. They're just genetically programmed to be like, they don't wake up in the morning and say, oh, I wish my leg was better. I have this sore knee. They just wake up. I need to get from point A to point B, and I'll hold my leg up if I need to, or I'll just fake it, or I'll move quickly. So I implore owners, every single episode of holding up their leg is important to identify and take action, and know that you can't rely on your dog's I'm willing to chase a squirrel as an indication that my joints are fine.
We'll be right back. Hey, dog lovers, is your furry friend limping or struggling to keep up like they used to? It might be osteoarthritis, or OA, a common source of pain and mobility issues in dogs that's driven by inflammation in their joints. Inflammation is the silent enemy, not only causing pain, but also accelerating the progression of OA. Synovitin OA is a groundbreaking one-time injection into the arthritic joint that targets the very cells causing the pain and inflammation. By eliminating these harmful cells, Synovitin OA breaks the cycle of inflammation, offering up to 1 full year of relief right where it's needed most. Don't let your dog suffer from the pain of arthritis. Visit ActiveDogNow.com to learn more about Synovitin OA and give your dog the gift of long-lasting, pain-free movement again.
Studied in canine elbows, Synovitin OA is given by authorized veterinarians. Temporary discomfort and treated joints may occur. Talk to a treating veterinarian near you for more information, including what to expect following treatment, and visit www.activedognow.com. You've described this, that it's over time, it's degenerative. Then there are partial tears, and then there's full tears. Does it matter? Like, why should we care?
We'll be right back. Hey, dog lovers, is your furry friend limping or struggling to keep up like they used to? It might be osteoarthritis, or OA, a common source of pain and mobility issues in dogs that's driven by inflammation in their joints. Inflammation is the silent enemy, not only causing pain, but also accelerating the progression of OA. Synovitin OA is a groundbreaking one-time injection into the arthritic joint that targets the very cells causing the pain and inflammation. By eliminating these harmful cells, Synovitin OA breaks the cycle of inflammation, offering up to 1 full year of relief right where it's needed most. Don't let your dog suffer from the pain of arthritis. Visit ActiveDogNow.com to learn more about Synovitin OA and give your dog the gift of long-lasting, pain-free movement again.
Studied in canine elbows, Synovitin OA is given by authorized veterinarians. Temporary discomfort and treated joints may occur. Talk to a treating veterinarian near you for more information, including what to expect following treatment, and visit www.activedognow.com.
The consequence that we're wanting to avoid is the cascade of arthritis, which is inflammation of the joint and loss of cartilage and decline in the quality of joint fluid. And that's painful, as anyone that suffers from arthritis or knows someone that has. When you lose stability of the joint, the cascade starts, and the cascade, I love visual analogies. My favorite visual for the cascade of arthritis is a snowball running down a pebbly hill. As it rolls down the hill, it picks up pebbles and stones. And once it starts rolling, if action isn't taken to stop it from rolling, it will just keep going. The great news of that story is that there's so much action you can take to stop that snowball from rolling down the pebbly hill. I do recommend dogs to surgery sometimes, but I do have the bias of the conservative route, but my biggest bias is choice and agency for clients and their dogs. But I have known thousands of dogs that had what we think is a full tear. And part of the challenge is that you don't know until you're in the middle of surgery.
Right.
So surgeons have told me, yeah, that one was just partial. A surgeon, of course, because you've worked with them and interviewed them. In the surgeon's mind, it doesn't matter. It needs surgery. But if we were trying to look at what's the actual truth, maybe the partial tear could still, stabilize the other ligaments. There's other ligaments around the knee that stabilize it, and muscle. When people will say, well, how do I know if it's full or partial? I'm like, you don't.
Yeah.
Then MRI would be the way, and no one does an MRI to figure out, or rarely is an MRI done, because they're so expensive and require anesthesia. So we think, well, why do the MRI? Just do the surgery.
We're just going to go in there. Yeah, we're just going to go in there and look anyway. And I will tell you, there have been many times I've seen a patient where, maybe we thought it was a partial tear and it was a complete tear, and that dog came in weight bearing, and you're like, wow, this is completely torn, and vice versa. Sometimes we've felt that it was a full tear and it's been partially torn. And there really is no way, if somebody says it's partially torn, without going into that joint, there's no way for me to say, is it 10% torn? Is it 50% torn? Like, how much tearing there is, not unless we get in there and look. And sometimes you're surprised. Yeah.
Absolutely. And I agree. Surgeons share, I ask the surgeons, when they go in, and it's pretty much agreed upon that their degree of lameness that they're showing, or their degree of pain that they're showing, is not an indication. And so it just adds to the trickiness. In this region where I am, you're only given a choice of a TPLO. That's it. Like, there's no even sharing with clients that there's lots of procedures. So that's $4,000 to $6,000. There's many people that's not an option for. And you're taking your kids' college fund. That's just real life. But I have classmates that I chat with in Idaho or Wisconsin, and I have a classmate that just retired. And she did thousands and thousands of the lateral suture technique, that was $1,500. And she didn't feel like there were dogs in pain everywhere. So it's interesting to me, region to region, how there's differences in the options and care that dogs are given.
And there was a time when I started my career, there was a time where lateral suture was all we did.
Totally. It was a new grad surgery.
Yeah.
Yeah. And so I'm not knocking progress and advancement in medicine, but I think people need to have options. And I observe dogs that have had TPLOs, because I work on a lot of those dogs. And I have a stance analyzer. So we'll do a stance analyzer like 8 months to 2 years down the road. And when they should be bearing 20% of their body weight in each hind leg, they're bearing 8 to 10. But everyone's like, well, they're great. They're fine. They're great. And then it's like, well, I measure muscle. The muscle is not symmetrical. So even when you have surgery, there is a lot that would be best to be addressed. They get along fine, but optimally, we're looking at all those things. So I think that cruciates are the biggest can of worm discussion that anyone can ever endeavor in, because there's so many factors, there's so many treatments. I have patients that are, say, it's the 12-year-old or 10-year-old pit bull that is a couch potato. Like, do they really need surgery, or do they need to build muscle and lose weight and maybe consider, once we get that done, like, then are they sore, or are they having a great quality of life, versus the hunting dog, which if you want to keep hunting, you need surgery. But ultimately, I discuss it with the owners as far as the pros and cons and your situation, and people seem to do well when they have a choice and an understanding.
I remember going to a conference, it was over a decade ago, and they had just come out, I think, with a longitudinal study comparing conservative management with surgical management. And long term, the outcomes were very similar. So, when the surgeons were saying, you have to get the TPLO, it's the only way your dog is going to, have a comfortable life and be able to, and like you've said, you're trying to address this potential cascade of inflammation. That study, and I'm sure there have been many others, have shown that, again, long term, the amount of arthritis and inflammation is very similar. So it may depend on, like you said, the lifestyle, how quickly they need to get back. And then back to your discussion when you were saying, like, there's no way to know, right? Like partial or full tear. I remember this golden retriever that came into my practice at Flow Dog years ago. That dog was so lame. The owner, I mean, she was a pet, but he liked to walk in the woods with her and, those kinds of things. And there was no way he was going to get surgery. Her knee was very unstable. Like when I did the orthopedic tests, the clinical exam, and it was even clunking and popping around, and, it had like a rotatory instability. And I'm like, okay, I educated him. I explained everything. And he's like, okay, nope, not having surgery. I just want to swim my dog. He didn't even want to engage in a physical rehabilitation program. He wanted to access our pool and swim his dog in a therapeutic pool environment. And I had to eat my words, because a year later, that dog was not lame. She was back to everything she wanted to do. There was no muscle atrophy. And now, I mean, then she, talk about age, right? She was maybe 4, and she's still around, still swimming in the pool, even though I sold my business, and she's like 14, so
That's
she's done great. And I would have bet a lot of money that she wouldn't do great and that she would need surgery down the road. So
that is great.
Yeah. And so maybe we can talk a little bit about this. Can you talk a little bit about the treatment options for this?
Well, one little thing I don't want us to be remiss in talking about is the meniscus. So the meniscus, which is sort of like the gorilla in the room right now, is a cushion that is between the two bones, between the femur and the tibia, and it can get torn or damaged. Traditional veterinary medicine or surgery, in the surgery world, it's said that the meniscus doesn't heal. And I have not done a study or repeated MRIs, except for my own MRI, because I have a full cruciate tear and I had 2 meniscal tears, and I lasered the bejesus out of my knee for 6 months, and my meniscus healed. And there's many dogs that I've worked with, and we presume based on clinical signs that there's meniscal damage. And those are dogs that were managed conservatively and are living great lives. So, but the meniscus is often more painful than the cruciate tear itself. So it's another variable in this whole scenario.
I'm glad you mentioned the meniscus, because oftentimes with that instability of the knee caused by the deficient cruciate, then it allows those two bones to, kind of grind at that joint. And concurrently tear the meniscus. If it doesn't happen initially, that unstable knee can kind of lead to a meniscus tear sometimes, not always. I'm glad you presented again the other side of the coin, because I thought that if a dog had a meniscus tear and a cruciate tear, that they really needed surgery, because that was going to be a long road and a poor prognosis. But you're saying that's not true.
In my experience, and some of these dogs, we haven't quite got to their treatment options, but I've worked with Orthopeds, which is a company that does custom stifle braces. And I've worked with their product for 18 years, and I've done over 1,100 braces. And I know some of those dogs had meniscal tears, but the dogs have their braces. It's a permanent brace. It's not fixing it. It's a brace that they get to wear for their whole lives. And I've had dogs that have had them for 12 or 14 years, and they live great lives, and they're waterproof. And it is a couple $1,000s, but it $1,800 to $2,000 with all the surrounding care. Of that, acclimating and the PT, acclimating to the brace and the PT. But it's a fantastic option. It's the option I chose for myself in my injury. Mm-hmm. And I always share the caveat that I don't ever chase squirrels, ever.
Right.
I'm glad you mentioned Orthopeds, because we interviewed Martin Kaufman, who is the founder of Orthopeds.
Yes, I know Martin super well.
Yeah. And
he's brilliant. He really is.
He is so brilliant.
Yeah. And it's custom, so it's going to ultimately, it should fit them very comfortably, and it will decrease the likelihood of skin breakdown, because we've got this as custom brace for this dog that fits them perfectly for their conformation.
Absolutely. And one plug I will make, not for Martin, but in the concept of braces, is I really believe that it needs to be custom. And please don't get it off the internet, because your success is going to be so much less.
I'm glad you mentioned, the off-the-shelf option is that it's not a good one. I agree. And I think you could actually do more damage, if not to the joint in question, due to maybe oddities of movement and things that brace causes, like a custom brace won't. Custom brace, it's designed to, be like a glove, match your body's biomechanics, and allow you to move and exercise as you would within that brace. Yeah. I was just going to say, one thing that I tell people is a brace is not controlling gross movement. It's not limiting the ability to bend and straighten the knee. These braces for a cruciate are designed to prevent millimeters of cranial or toward the head thrust of the lower leg out from under the femur. That's what that cruciate ligament does. And so when it's not there, it's like a drawer sliding out from under the thigh, and it happens over and over and over again. So the brace needs to control micro movement, millimeters of movement. And you can't get that without a custom brace, period.
Or with a soft brace. And that's just like a fancy sock. So I just say, just trust me on this. It needs to be custom. I've done my homework for a very long time. So whether it's, another company or not, I'm loyal to Orthopeds, but just make it custom.
So Dr. Finn, let's get into the root of this. We've kind of alluded to some of the things that go into the decision-making, right? The lifestyle of the dog, are they an athlete? Are they a working dog, or are they a couch potato? Maybe their age, if they're an elder dog, why put them through surgery? Their size could potentially impact, because I think there's a lot more stress on the knee joints of larger dogs, just because of the weight and the physics of the the biomechanics, their energy level, breed considerations. You mentioned cost, maybe the ability to comply with restrictions, conservatively, non-operatively, or the rehab process, which many surgeons have told me over the years that the surgery is 30% and the rehabilitation and what you do after the surgery is 70% of the success of, addressing that cruciate with surgery. And I don't think they were trying to toot my horn. I think that they really believe that. It doesn't mean that you have to go through formalized rehabilitation. That's ideal, I think, in a lot of situations, but educating yourself, doing the things that now I hope you're going to talk about. What can pet owners do to maximize their success in terms of a cruciate injury?
Excellent question. And I like to start kind of at the lowest kind of level, but the most important is controlling their activity, even if they haven't yet been diagnosed with the cruciate ligament, but they're lame sometimes and not other times. That's when your leash goes on. It's the cheapest thing to do. It's simple, but not easy, because say it's 10 o'clock at night and your dog has to go out to the restroom. And then you're like, okay, I have to put my jacket on and walk my dog on a leash in their own backyard. It's not easy, and it can be a pain in the neck, but it's pivotal to control their activity. And I like to say to my clients, you're the one with the thumbs. Walk your dog on the leash. You can be smarter than them, and you can completely control that for free. Oftentimes when someone comes to me and they're like, yeah, my dog was diagnosed with a cruciate, what should we do? We have surgery scheduled in a month. And I say, well, what is your dog doing right now? And they're like, oh, whatever they normally do, like running around the backyard. And I'm like, well, put the brakes on, just because you're having surgery doesn't mean you want to beat up the joint. So number one is controlling their activity. I'm a huge fan of icing them. And if they're not three-legged lame, just walking. The most body part, I know this from your training, but the most body parts, meaning joints of the whole body and muscles and ligaments and tendons, move the greatest range of motion at the walk. Dogs and people are meant to be walking all the time, and that maintains muscle tone, and muscle tone is imperative. So when they're not three-legged, but just walking them, controlling their activity, keeping them on a leash. If they're very lame, go ahead and use the leash, go out to potty and back in. That like leash walk to potty only is as far as things that you can add nutritionally. You have this great opportunity if you're waiting for surgery or you're trying to decide what to do, or if you're just treating it conservatively, that's the time to work on cutting their calories. And that's a whole other podcast into itself. So I will just stop with the cutting the calories, because the majority of dogs in America, actually, I think 68% was the last statistic, are overweight. So you start getting on a routine with your regular veterinarian or holistic veterinarian as far as cutting the calories, adding collagen. Collagen is something I've been using for years and years, because there is no collagen in a dog's diet if they're on a kibble diet or even if they're eating raw meat. There's no collagen in muscle. It's muscle. So collagen is sold as a powder, or there's lots of different ways to get collagen, but it's basically what the ligament is made of. And so giving them the building blocks for the ligament is pretty low expense and something you can do. So those are kind of your starters.
Yeah. Before you go on, so can you give an example of what collagen would be? Because so many of my pet owners say, well, I'm giving them a joint supplement, but they don't know if it has collagen in it or not. Is collagen and chondroitin the same thing, or glucosamine, or, I hear about like green lip muscle?
Great question. So collagen is collagen. It's combination of amino acids, so the building blocks of protein that aren't in other stuff. So there's some supplements are adding collagen to them. There's only one or two out there, but chondroitin is not collagen, glucosamine is not collagen. Green-lipped muscle is a wonderful source of fatty acids, but not collagen. So you can buy collagen as a powder, and then you just add it to their dog food. You can't throw it on top of dry food, because then it's just powder on top of dry food. Mm-hmm. But you mix it with either canned pumpkin or anything really that your dog is getting. But it's absolutely imperative in my mind for human cruciates as well as animal. So, there's some, I don't know how you feel about promoting certain stores, but Costco, believe it or not, has 2 different collagens that they sell as a powder that are actually high quality. The one I use is because I met the gentleman that owns the company. He turned me on to the collagen. It's step above proteins or step above collagen. Sometimes when you're Googling it, you do either one. Amazon has it, or you can go to Chewy has it, or the company has its own website. And I feel like they're number one in my opinion. And when you're feeding collagen, you're feeding grams. So on those little treats that say they have collagen, they're feeding milligrams, which is a tiny amount. So I put 2 tablespoons in my coffee or tea or whatever. It dissolves and it has no taste. So I put it in my coffee or tea or whatever smoothie every day, 2 tablespoons. And for a dog with an injury, I want them to get 2 tablespoons twice a day for a 50 or over pound dog. And for a small dog, you just extrapolate backwards, for a dog that's 15 pounds, they're going to get a 1/4 teaspoon twice a day forever, because you're always going to need collagen. We have a recipe that we hand out to clients that came from my Chinese medicine school, and it's tendon ligament soup. You basically are making a bone broth, but out of tendons and ligaments. And it's this gelatinous stuff. Once it cools, that's the good stuff. That's the collagen.
Dogs would probably eat that right up too.
They love it. Super high calories, right. So you have to be careful, but it's amazing. But bone broth, which many, many people feed, and that's beautiful and wonderful. I love that. It's got minerals, it's got calcium, it's got a lot of fat, but no tendons or ligaments, no collagen. Because a long bone, which usually would make a bone broth out of, doesn't have ligaments on it. Once it's put into bone situation, would have, mostly muscles. When we're recommending to make tendon ligament soup, you use the foot bones of a cow or a sheep or goat, not a pig, because they don't have the same amount of ligaments. But you think of a cow's foot, not their hoof, but the foot. There's 3 bones in the feet. There's many, many ligaments in connecting all those bones. So that's going to be your rich source.
Can I ask you, 2 things I want to say. One, I just want to circle back real quick to your restricting the dog's activity, because this is where I get the most pushback from clients, is their ability to, restrict their dog's activity. But Chris and I did a whole show on just environmental enrichment stuff that you can do at home to,
awesome.
To do this, have this mental expenditure without running around throwing the ball. So just one, there are things that you can do to entertain your dog and keep them mentally, stimulated at home without taking that 3-mile hike. there are lots of things you could do. So people should check out that show. But also, how are you integrating this in, or collagen in, with things like non-steroidal anti-inflammatory drugs or gabapentin? Can we mix those all together? Is that the best way to use them?
So collagen should just be, like, in my opinion, well, and it's just science. We know they need the collagen, but I mean, from the time your dog's a puppy, it should be getting a source of collagen in the diet. And there is zero collagen in a kibble. So I'm not having an argument whether you should feed kibble or not here today, but you need to provide a source of collagen, from the get-go. Then you can add, if need be, my dogs get other joint supplements, and they get green-lipped muscle as well. And then all those things, are not interfering. And then I very infrequently have to give a dog of my own, Rimadyl or gabapentin, but some non-steroidal patients, every patient comes in, they're already on a non-steroidal. And so we add the collagen without worries, and they're maybe on gabapentin as well, and they may be on tramadol. And then, I don't tend to interfere a lot with that. If that's their vet's plan, then as they're feeling more comfortable, or we're doing other things like Chinese herbs, golden yellow paste, which is very inexpensive anti-inflammatory, which is a turmeric paste. So, but to answer to your questions, does not interfere with all those other things and can be added with it. And when you were talking about enrichment exercises, one of my first, I have this handout that I give pretty much to anyone that asks for it. I just email it to them, but, it's controlling the activity and what I call the snack search. So, taking your dog on a leash and just walking them around, even if your yard is a tiny yard, just throw the food out on the yard, and whatever kibble or dehydrated raw nuggets or little pieces you have, if you want to cut up little cubes of cheese. And if you just toss them, your dog is on a leash, so they can't run around and hurt themselves. And then you just be quiet and be invisible.
Foraging is fun.
Foraging is fun. I love that. I'm going to start using that. Foraging is fun. And you ladies probably talked about doing it within the house, that you can hide food, or the snuffle mat, which is, amazing that it took 100 years to invent the snuffle mat. Just a mat that gives them an ability to hide food in it. And so they sniff it and snuffle it. And we know from research that a dog is releasing serotonin and other calming hormones when they're sniffing and snuffling and foraging, and that using that mental activity is actually physically fatiguing.
Kathy, you circled back, and I want to circle back too, because one of the challenges that I have is this whole calorie restriction thing, and I think with exercise too, so many owners just see it as this huge barrier, and they're like, I'm only feeding them a half a cup. I can't cut back anymore. They're not exercising as much. They're not burning the calories. So they're gaining weight because of their injury. How do you talk to that? How do you counsel those people?
That's a giant can of worms. First of all, like you ladies were talking about enriching. So make each bite of food an exercise. So meaning hide the food, put it in a snuffle mat. So then that meal is lasting that much longer versus a dog that just puts his head down into the bowl. The food is, swallowed within seconds. And that is very unenriching and boring. So making it a lot harder. I use pumpkin. I buy pumpkin by the case, canned pumpkin, and I smear it on the inside of a mug and freeze it. So then it's a popsicle. And the freezing makes it last a bit longer. Canned pumpkin has almost 0 calories. There's a few dogs that don't like the canned pumpkin. Sometimes you can dress it up with some low salt chicken broth.
So I know a while back, Dr. Finn, as we've expounded on these things, you said, this is the starting point. These are the things I recommend. So, just to review, it was activity restriction, supplements in terms of collagen, diet and how it can be helpful, weight loss if needed, and embracing. What other things, as we go along, what other things do you discuss with your clients that have dogs with CCL injuries?
I will say you're not paying me to say this, but every day, all day, I'm talking about the laser. And I've had, I think, 30 clients buy the MedcoVet laser. So the laser is so amazing for pain relief, for joint swelling, for healing of the ligaments that are damaged but not fully torn. So I'm all about the laser. If they don't want to make the investment in the laser, we laser them here. Ice, because ice, as we all know, ice is for acute inflammation. But I had a instructor tell me a long time ago, every time you walk on an inflamed joint, you have made it acute again. The ice is appropriate. I iced my knee on and off for years. Like if I'm planting a tree or I really torque it, not in the last year, but up until the last year, if I just torqued it and I'll just, like, oh gosh, okay, well, I finished what I'm doing. And then I go in and I wrap ice back on it. It wasn't acute, but I made it acute by re-injuring it. So an ice is free. People, it's the most commonly forgotten thing with a dog, I have found.
So how do you feel about, do you have a go-to exercise, or what do you recommend in terms of that, for those clients that maybe aren't going through formalized rehab, something that they can do at home that is helpful, because you're a fellow canine rehabber, certified in that as well. So I'm sure you have some ideas in terms of what you like.
If I had only one PT exercise or rehab exercise for every dog on the planet, it would be walking through an extension ladder or something that's made to look like an extension ladder on the ground, because they have to flex the joint to take the first step. Then when that leg goes down, all the weight is then shifted onto that leg. So that leg's working slightly harder for a moment in time as they lift the next leg and go through the whole process again. So you get flexion, extension, and load. And with a ladder, you're doing it in a channel and you're doing it multiple reps in a row. Number 2 is walking on a squishy mat, like that's just a few inches thick. Very simple, very safe, very low impact. But some people put their dog beds in a row. Some people put the couch cushions in a row. When your dog steps into the squishy mat, they have to have a challenge by they stepped onto a slightly unstable surface. So the little proprioceptors in the knee are going, oh my gosh, what do we do? And then they take the next step. So it's a mild challenge. That's a very beginner, beginning of the injury, once they're feeling better, not when they're lame, but once they can walk comfortably. Walking through the squishy mat is simple. And then kind of as things are improving, the front paws up, which I ruled the universe, I would not call this front paws up. I would call it hind end loading. I see 80% of people, even on the internet, even people that should know better, doing front paws up, but the hind end, the weight's not shifted onto the hind end. Using a little bit of a treat to kind of lure their head to elevate and shift back so that the hind end is loading. And doing it on a 2-inch or 4-inch step is really valuable, but you have to pivot your dog's weight encourage their weight to shift so it's loading the hind.
We actually have a really good video of that on our YouTube channel that Chris did a tutorial.
Nice.
Yeah, she did a really nice job with it, actually.
Well,
good job, Chris.
Dr. Finn will have to look at it to make sure that I was actually doing it correctly.
Oh, I'm sure you were. So how do you feel about the changing the name?
Because it's a mind shift. So then it helps people to know what the goal of the exercise is. I have them stretch forward because I like opening up the hips and kind of working concentrically and eccentrically. And then, like you said, kind of pushing that treat cookie back into their muzzle to shift then their weight back on and load those hind limbs. So I will draw them back and forth.
Sure.
I think there's value in that, but
no, I agree. I think that the hips are often overlooked by, or it's not understood at owners. Any dog whose knee hurts tightens their hip. And then, so sometimes range of motion is something I have people implement right away as well. And people will say, well, they don't like when I do that. And I say, just gently do some massage on this hip area here and watch their leg just go into extension as they relax, because they're tightening up their hip to guard the leg. And one thing that we really touch on is other treatments. What are the conservative treatments? We talked about management, but and this conservative versus surgical, but there's a whole lot in between that I do. And I have lots of patients who have done really well with these. You know, we had the braces, but I also use amnion-derived stem cell, a company called Anacell, who I would love for you to connect with because the products are extraordinary. So basically the amnion is gathered from the puppies at C-sections, which in this country, for better or worse, there's many, many breeds who can't have their own babies without a C-section. So the company has contracts with those vet clinics, and they gather the amnion and they have their process of purifying and getting it out of there. So basically, I call on the phone and it's overnighted in a little vial. It's a liquid on dry ice. And then I don't even inject it in the joint. You inject it adjacent to the joint. And I've had lots of dogs that did really well with that. It's like $2,000. So versus the other stem cell that you're, anesthetizing the dog to get falciform fat, which has got negligible amount of stem cell. So I will do that in some cases, and I've been really happy with it. And then the really cool thing about the Anacell treatments, I don't anesthetize them. It's a sub-Q injection adjacent to the joint. And then you start rehab the next day because you want to, we employ some laser to help stimulate the area. And then the PT also helps stimulate the stem cell at a molecular level to get going stem cell. And then one thing that anybody that does a deep dive on cruciate ligament injury treatment on the internet will stumble upon prolotherapy. And I've had many people come to me because I do prolotherapy. Prolo stands for proliferative. So it's injecting a solution with a high molecular weight. Most people use a solution of 50% dextrose, which when I first heard that, I learned it on the racetrack because I was an equine veterinarian. So I'm like, if I can do this on a racehorse, I could do it on a dog. And on the racetrack, you didn't use dextrose. So the first thought of you want me to inject sugar? You want me to inject food into this dog's leg? But it is, again, not into the joint, but the ligaments around the outside of the joint. A combination of dextrose. I like to put polyglycan, which is a glucosamine hyaluronic acid, chondroitin injection. Everybody puts a little B12 in there because it's magical and it makes things pink. And various people put some other homeopathic things or Tramiel or Zeal. And basically you're injecting adjacent or into those collateral ligaments and sometimes the patellar ligament so that the body goes, what's going on? And starts like laying down more fibrous tissue. And I have had that very, very particular who I choose for that as far as appropriateness. What's that dog doing? You know, your young lab that's going to go hunting. We're not having the conversation. But your older dog, or I did it on a Springer Spaniel that was an active hunting dog. I did laser and prolotherapy because we had 3 weeks before her next season. And it was an older gentleman and an older dog, and it worked great. Whenever I do it, I'm very happy with the outcome. I'm just super cautious in who's right for this treatment. It's super inexpensive, a couple $100, but it's out there. It's not for many, but it's great for some.
Speaking of injections and things, are you a believer in PRP?
When you can do stem cell that has 100% of stem cells, when you do Anacell, that has 100% of stem cells, for me, why would I do something that has less? That's way more expensive for the procedure.
Right. And just for folks that don't know it, PRP stands for platelet-rich plasma. And they will take, a professional will take blood out of your pet. They spin it down in a centrifuge and then inject the platelet-rich plasma that has been gleaned back into the area of injury. So it can be used for soft tissue injuries and joint issues and things like that. So, I guess in talking to you, as I mentioned, you're enlightening us to things I hadn't thought of. Just like the pet owner has many options, so do professionals. And it's a matter of educating, meeting them where they are, allowing them to make the decision with counsel. There are many, many, many paths to take, and none is wrong. Anything else that we want to cover, or do you have a last thought or, pearl of wisdom that you want to leave our audience with?
The first thing I say is it's never an emergency. So you can take a deep breath. You've got time. There's things you can do, and you can take your time to get educated. Just keep your dog's activity under control, meaning put the leash on them.
As we're wrapping up, can you let the audience know where they can find you?
Sure, thank you. My website is Finn, F as in fish, INN, or I can be emailed at office@finndvm.com. They can see my class offerings through my website. So that's where all the stuff is.
Right. There's some good blogs on that website too. So if you go and check it out.
Right. And I do want to mention to folks that I alluded to your unique business model, and you have a subscription service, and that allows access to you on a weekly basis, and also to educational videos, as well as some members only content. It's currently $19 per month. I think that sounds like a great value. It's less than $5 a week. If you learn something here today, which I know I did, then I would say that, that might be something worth exploring. And you've said too, there's no commitment. Like you can join, and if you're not satisfied, you can, abort your membership at any time. I think that's an awesome service, again, to get your knowledge out to the masses, just like we want to through Petability. So to be able to reach people certainly around the country, but around the world. So
yes, thank you. And that's my goal, is for, when people are confused or they have questions, I feel so strongly that I want to answer those. And I feel like nowhere on planet Earth can people just log on a Tuesday and ask a vet a question. So,
wow.
Yeah.
And then we have, our community. So as far as the other people that are on there.
Well, thank you again for all your time today. And I learned a ton. It shows that CCLs are your jam.
Thank you, Dr. Finn. It was nice to meet you. And thank you for enlightening us today. I appreciate it.
It was great. Thank you.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.